The following demonstration illustrates the AccuCirc procedure on an educational model. Inspect the penis for any abnormalities and, based on your finger size, estimate the correct size of the device to be used by comparing it with the circle on the package label. Prepare all the components required for the procedure. Open the AccuCirc tray lid and lay out the iodine swab sticks, sanitizing wipe, petrolatum dressing, lubricating jelly, fenestrated drape, gauze, and surgical pin for easy access. Prepare the entire penis and a 1-inch area surrounding the penis with the iodine swab sticks. Remove the backing from the adhesive strip and place the fenestrated drape over the penis, ensuring the drape is securely attached in place. Use the surgical pin to mark the foreskin at the coronal margin. Making the pen mark is an essential step because the mark represents where the incision will be made when the mark is properly aligned on the top of the ring. Consider using analgesia according to hospital protocol. Place some lubricating jelly in an easy access location for use later in the procedure. Gently attach the hemostats at the 3 o'clock and 9 o'clock positions on the foreskin, ensuring there is an adequate amount of tissue purchased to complete the subsequent steps. Apply a small amount of lubricant to the top blunt end of the probe and carefully insert the tip of the probe in between the glands and the foreskin, removing by blunt dissection any adhesions, and thus freeing the foreskin down to the level of the coronal margin marked by the pen mark. If needed, detach one hemostat and use it to gently stretch the opening of the foreskin to make sure the opening is large enough to accept the shielding ring. Reattach the hemostat in the same position as before. Holding the probe like a pencil, apply a small amount of lubricant to the shielding ring and insert the ring into the foreskin that is being held open by the hemostats. Once the ring has been inserted, it can be pushed down on top of the glands and the foreskin pulled up more fully around the ring. Lower the foreskin holder down onto the foreskin to hold it in place. Use a hemostat to position the foreskin so that the pen mark is circumferentially aligned on the top of the ring. Again, the pen mark represents where the incision will be made after the mark is circumferentially aligned on the top of the ring. Place the clamp over the probe. The probe will extend through the top of the clamp and will lock into place with an audible click. Then activate the lever arm downward until it locks into place against the clamp housing. As the lever arm is activated, the AccuCirc will crush and cut the foreskin, timed and executed by the device itself. Keep the clamp in the closed and locked position for at least 5 minutes to ensure hemostasis. To release the AccuCirc, push in on the locking clip, release the lever arm, and lift the lever arm completely back to the up position to remove the device. Use the sterile gauze to control any bleeding that may occur following the procedure. Once hemostasis is ensured, petrolatum dressing can be used to wrap the site. Although the foreskin probe shielding ring is locked in place and should not be removed from the clamp after the procedure, it is done in this demonstration to illustrate the complete circumferential cut of the foreskin. Discard the used probe and clamp according to hospital protocol.